السلام عليكم ورحمة الله وبركاته. محاضرتنا لهذا اليوم بعنوان Pathological Lesions. Dental caries. Radiography is useful for detecting carious lesions because the caries causes demineralization of enamel and dentine. The lesion is seen in the radiograph as a radiolucent dark zone because the demineralized area of the tooth doesn't absorb as many X-ray photon as the unaffected portion. As we seen in this bite-wing radiograph, we can see the interproximal caries between the deciduous D and the lower 6 in both upper and lower jaw. This is a radiograph of central and lateral, as shown in the black arrow interproximal caries. Also, lower 6 with distal caries. Also, these bite-wing image show interproximal caries. Periodontal disease. Radiograph assess the periodontal disease and provide unique information about the status of periodontium. Periodontium, that means the alveolar bone that surround the tooth, and the periodontal ligament, also the gum. But the gum cannot be seen by X-ray because it is soft tissue. So we can assess the level of interproximal bone and the periodontal space and permanent record of the condition of the bone level. Radiographs aid the clinician in identifying the extent of destruction of alveolar bone, local contributing factor, and feature of periodontium. As we seen in this radiograph, this is normal appearance of interproximal bone that located about 0.5 to 2 mm below the cemento-enamel junction of the tooth, and it has a compact bone continued with the lamina dura of the alveolar bone. This is normal appearance in the posterior teeth, while in the anterior teeth you can see the level of alveolar bone. Also, it located about 0.5 to 2 mm below the cemento-enamel junction, depending on the age of the patient, and regular, triangular in shape, continued with lamina dura. In this bite-wing image, we can see interproximal bone loss. You can see the level of the bone below the cemento-enamel junction more than 2 mm. It's about 4 to 5 mm. And there is no continuation with lamina dura. Also, the surface of the bone is irregular, sharp, and not smooth. Also in this image. In this image, we can see vertical bone loss. Bone loss in bifurcation area or bifurcation area involvement. Inflammatory disease, including any disease that affects the pulp of the tooth. It causes early inflammatory disease, cause discontinuation of lamina dura and widening of periodontal ligament. Then it will cause a radiolucent lesion in the periapical area. It's called periapical changes or periapical lesion. As we seen in this image, this is image of lower 6. We can see carious lesion and widening of periodontal space, bifurcation, involvement, discontinuation of lamina dura. Also, we can see pathological condition called osteitis, sclerosis osteitis. This is caused by defense mechanism and hazy accumulation of bony trabeculae due to chronic infection that cause sclerosis of bony trabeculae, cause condition named sclerosing osteitis. As you observed in this image also. You can see in this upper lateral incisor there is apical radiolucent area that caused by inflammatory disease, and after the treatment it still appear until about 6 months, then disappear. That means complete healing. After injury or surgery or trauma, this cause bone scar. It a radiolucent lesion with hazy trabeculae of the bone. Now we discussed cystic lesion. The cyst has well demarcated boundary and it's loculated, محدد, with well demarcated boundary as this cyst. This cyst include the root apex, therefore it's called radicular cyst. This type of cystic lesion called dentigerous cyst, which involve the crown of impacted teeth. Keratocyst, large cystic lesion located mostly in posterior mandible, including the angle of mandible and the ramus of the mandible. It's not associated with root and root apex. It causes resorption of the bone, but the tooth is still vital. This is called keratocyst. And we have also lateral periodontal cyst. The cyst associated with the periodontium of the tooth, but located laterally. So we can differentiate it from the radicular cyst. Radicular cyst located at the apex of the tooth, while the lateral periodontal cyst located laterally. Nasopalatine duct cyst, which located between the two central incisors, and it has a heart shape. Dental anomalies, including developmental anomalies such as number of teeth, supernumerary teeth, hyperdontia. As we seen here, this is a mesodense that located between two central incisors. Any teeth located between two central incisors called mesodense. And this is supernumerary teeth in the middle area. On the posterior part of the mandible, we have also supernumerary teeth. Or we have hypodontia, that means missing in the number of the teeth, as we seen here. Size of the teeth, macrodontia, as we see in this upper central incisor, it has large size. Or microdontia, when the tooth is small in size. A transposition. In this image we have central, lateral, first premolar, canine, and second premolar. There is a transposition between the canine and the first premolar. Morphology of the tooth. We have two terms, fusion and gemination. Fusion, that means union of two teeth, as we see here. Two teeth, two crown, two roots. While gemination, single tooth buds attempt to divide. That means we have two crown and one root. Consecrescence. That means the root of two or more primary or permanent teeth are fused together by cementum. Taurodontism. Elongation of the crown of the root with a shortening of the root. Dilaceration. A sharp bend or sharp curvature of the root. Dense invagination or tooth in tooth, as appear here. It like a tooth-like structure inside the pulp of the lateral incisor. And we have dense invagination. That means something like tooth structure appear on the surface of the tooth. Amelogenesis imperfecta. Genetic anomalies due to a mutation that occur in the enamel formation. Therefore, the tooth appear without enamel layer, appear as prepared. Dentinogenesis imperfecta. The mutation occur to cause disturbances in the dentine formation. Therefore, the enamel appear, but the dentine has a hazy appearance or a ghosty appearance. It's like a ghost picture without pulp appearance. Pulp sclerosis. Sclerosing of the pulp tissue, as we seen here. We have also acquired dental anomalies. Attrition, wearing of the dentition resulting from occlusal contact between maxillary and mandibular teeth. Some patient has a condition called bruxism that bite heavily on his teeth that cause attrition. Abrasion. Abrasion, same as attrition, but not in the occlusal surface, in the proximal surface of the teeth. Fractured, you know the meaning of a fractured tooth. Internal resorption. Observe the absorption inside the pulp. You can see this called internal resorption, and external resorption as this upper lateral incisor. We can see the absorption of the root. Pulp stone, a stone that located inside the pulp. Hypercementosis, increase the activity of cementoplast that cause hypercementosis. Thank you for your listening.